Assalamu alaikum warahmatullah. Today I will introduce new topic, and it's about something you have to focus when you take your HAAD exam, clinical biochemical specialty. It's not only for HAAD exam, but also it can be for the HA exam, MOH exam, and even if in the university, if you have clinical chemistry oral test, also you have to focus on it. So today I will introduce the main topics you have to focus on. In the HAAD exam, there is 4 points they focus on, which they are the language, attitude, practical, and theory. In the language, they focus on how fluent you are and your English language, how do you use your English words, how you express the answer through using correct English verbs and English language. So you have to have very good English, and you have to be fluent, and you have to know how to express your answer in your own words. And this is about language. Also there is attitude. So in the attitude, you have to sit well first, and you have to be confident. You are very confident and sit well. And the most important things is you have to keep direct eye contact with the examiner. Don't feel shy, don't feel afraid or feeling scared or like this. You have to sit well, and when they ask you any question, you have to answer the question immediately. Okay, if you don't know the answer exactly, you have to say actually you have to introduce some words that get you relaxed, and you can give answer. But if you never know the answer, say to the examiner, I don't know. You will save the time. Okay, and it is better to you more than you can suggest wrong answers and like that. And then also there is practical. They can ask you many things about the practical inside the laboratory to test your knowledge about the things inside the laboratory. How can you behave, how you can make decision. You have to be a decision maker. And also they can ask you many things. I will show it to you later. And also they can ask you about the theory, the interpretation of cases, the physiology and pathology, and something like from theory. So you have to focus on these 4 points: language, attitude, practical, and theory. If we say that the full score is 100, so the every point will take 25%. They are equal: language, attitude, practical, and theory. So we will begin with the number 1. The most important points is quality control. There is many points you have to focus on quality control on HAAD exam, clinical biochemistry specialty. The number 1, Levy-Jeannine chart. You have to know what is Levy-Jeannine chart, how can we construct the Levy-Jeannine chart, and how can we interpret the quality control performance data on the Levy-Jeannine chart. And you have to also know about Wizard rules. What is Wizard rules and how can we use it? And if every rule you have to know what does it mean, and if we have to reject the run or if we have to accept the run, what is the only rule that we can accept the run but it is warning rule, and like this is Wizard rule. You have to read about Wizard rules. Also you have to know about the routine quality control program, the daily quality control program inside the lab in every department. You have to know about it. Okay, also you have to know about the corrective action if there is any quality control data out of control. So you have to make a corrective action. What is the corrective action? What can I do in order to make my quality control data performance well? Also, you have to know about precision and accuracy. What do we mean by precision and accuracy? When can I say the performance of our data is not well, and there is imprecision and there is inaccuracy, and how can we measure the precision and accuracy inside the laboratory? You can read about it. Also, there is verification and validation. What do we mean by verification and what do we mean by validation when we buy new instrument? Also, you have to read about it. Okay. Also, you have to read about internal and external quality control. What do we mean by internal and what do we mean by external quality control? They aim to what, and we can get what from them, and the difference between internal and external quality control. Also, you have to read about it. The final point in quality control is the difference between the control, calibrator, and the sample. You have to know the definitions of these three words: control, calibrator, and sample, and everyone. What can we use? When can we use it? And it gives what when we use it. And so this is the main points that we have to focus on quality control. The point number 2 that we have to focus on is about phlebotomy. When we collecting the sample, they can ask you many questions about this topic, like order of draw, if patient has many samples and many containers, and so which container we can start with, and which the next one, and the next one, and the last container we have to end with. So this is called order of draw, so you have to know about it. Also, the colors of containers. Each anticoagulant has a universal color, international color, so you have to know the colors of the containers and each anticoagulant inside this container. Also, you have to know about rejection criteria. There is 2 types of rejection criteria: rejection criteria type 1 and rejection criteria type 2. So you have to learn about these rejection criteria and the definition and the difference between them. Also, the type of anticoagulants and the usage of it. There is many types of anticoagulant in hematology or in clinical chemistry or like this, and so the difference between them and the usage and the principle for their working, you have to know about it. And also, you have to know about sample precautions, sample collecting precautions. There is many parameters that you have to has your own special conditions, just like ammonia and blood gas analysis and bilirubin. There is many special situations that you have to offer for it to preserve it. So you have to learn about this also. This is about phlebotomy. The point number 3 that you have to focus on is lab safety. Okay, lab safety is the major topic that you can be asked on a HAAD, clinical biochemistry specialty exam. So they can ask you about the accidents inside the laboratory, like eye accident, skin contact, ingestion, and like that. What you have to do, okay, in order to respond to these accidents. And they can also ask you about chemical spill. If there is chemical spill on the floor or on the bench, how can you manage the situation? And also about major spill. There is something called major spill in the lab safety. How can you handle it? And about needle stick. If there is anyone hand needle stick, what you have to do, and the fire policy. I uploaded few days ago video about fire policy. What do we mean by code red policy? Also, you have to know it. And finally, about material safety data sheet. What do we mean by material safety data sheet, and what is this, and what is its content, and why we use it, and like that. So this is the main point that you have to focus on lab safety. Also, there is point, it belongs to theory, most of theory, about diabetes and sugar. Okay, this is topic they usually ask you about it in the HAAD exam, biochemistry exam. You have to know about physiology and pathology of diabetes mellitus, and the interpretation of glucose results, if it is fasting glucose result, or 1 hour, 2 hour urine sample, and the interpretation of diabetes mellitus and gestational diabetes mellitus. You have to know each result, what does it mean, and you have to know the reference range for glucose. Okay, you have to know all about this. And also you have to know the monitoring of diabetes mellitus. How can we monitor the diabetes mellitus cases? And you have to solve different cases in diabetes mellitus. You can find it easily in the internet. So they 100% ask you about diabetes mellitus and sugar in the HAAD exam. Also, the main important point that you can be asked about decision making inside the lab, if you are a decision maker or not. If there is kida, how can you manage the situation? If there is like that, how can you manage the situation? If there is accident, if you receive unlabeled sample, if you receive leaked sample, if you receive deteriorated sample, if there is problem with you see, this is called decision making. So you will 100% ask about something related to decision making inside the laboratory. Also, the most important point is how to interpret the result. They can give you cases inside the exam, and they can give you results for patient, and they ask you to interpret the case and ask you to interpret the case and why that's happened. You have to give them cause. Okay, so you have to know all the reference values in SI unit. Never view the reference values in the milligram per deciliter. No, you have to know it with millimole per liter. Okay, and you have to know the hyper and hypo, also the bath physiology and the signs and symptoms of all cases. Okay, you have to know about it. Also, you have to know about calculations. They can give you equations inside the exam, and they ask you to give your answer. So in chemistry there is lots of calculations. Also in hematology there is lots of calculation. Here they cannot ask you about hematology, but you have to focus on chemistry only, so you have to know all calculations. In previous videos I uploaded, I have 3 videos about hardest equations in clinical biochemistry, so you can return to it. Also, they can ask you about cardiac profiles. They can give you case, so you have to focus on the 5 cardiac biomarkers, which are troponin, CKMP, AST, LDH, myoglobin, and when they can start. I know it is a terrible topic and most of us hate it, but you have to know something about instrumentation. You have to focus on 2 main instrumentations, which are immunological technique, immunoassay, mainly ELISA. You have to know about ELISA and different types of ELISA: competitive, incompetitive, non-competitive, and also heterogeneous and homogeneous. What do we mean by that words, and how can it work, and the principle of it? You have to know about it. Also, you have to know about flame photometer. They can ask you about electrolytes measurement and the principle of the flame photometer. And they cannot say to you, they may say atomic absorption spectrophotometer, and you can get confused. They simply mean flame photometer. So you have to know the principle of flame photometer and the components of it. Also, you have to know about colorimeter, spectrophotometer, nephelometer versus nephelometry versus turbidimetry. You have to have small ideas about these instruments. This is all points that you have to focus on HAAD clinical biochemistry exam, because there is exam on September 9th.